Welcome to the deep dive. We're here to sift through the noise, pull out the key facts, and help you get truly informed. Today, we're looking at something deep inside the human body, a heart condition that's actually quite common but often flies under the radar. We're doing a deep dive into hypertrophic cardiomyopathy, HCM for short. Sounds a bit complex, I know, but stick with us. Our mission today: to really unpack what HCM is, how it changes the heart, where it comes from, often genetics, how doctors spot it, and what can be done about it, all drawn from solid sources.
Yeah, and it's a really important topic because HCM can be silent, but understanding it, well, it can make a huge difference. And the information we've gathered, it lays things out pretty clearly, I think. Makes it easier to grasp.
Okay, so let's jump right in. The big question first. What exactly is hypertrophic cardiomyopathy? What's actually happening to the heart muscle?
Right, so fundamentally, HCM is where the heart muscle wall, the myocardium, the bit that does the pumping, it gets thicker than normal. But it's not just thicker, it's often kind of disorganized growth. This makes the muscle stiff, less flexible, and that stiffness, well, it means the heart struggles to fill with blood properly and then pump it out effectively to the rest of your body. We almost always see it affecting the left ventricle, that's the main pumping chamber. And the septum, the wall between the left and right sides, that can thicken up too. But, how thick it gets and exactly which part of the muscle is affected, that really varies from person to person.
Right, so it's the muscle itself becoming, well, less efficient because it's too thick and stiff. And here's something from our sources that really stood out to me. This is mainly a genetic thing, isn't it?
That's absolutely right. For the most part, HCM is caused by a change, a mutation in one or more genes. It typically runs in families.
Runs in families? How much so?
Well, the statistic is quite stark. If one of your parents has HCM, you as their child have a 50% chance of inheriting the gene mutation for it.
50%, wow. And you mentioned it's quite common overall.
Yeah, the prevalence is estimated at around 1 in 500 people in the general population, using UK figures as an example.
1 in 500, that's a significant number of people potentially walking around with this.
Exactly. And given that it can be silent, like we said, many might not even know they have it, which really highlights why family history is so important here. If you know it's in your family, you can actually be proactive about getting checked.
That makes perfect sense. A real need for family awareness. Now, speaking of being silent, our research mentioned that lots of people with HCM actually have no symptoms, or very mild ones. They live pretty normal lives. But for those who do get symptoms, what sort of things might they notice?
Okay, so for those who are symptomatic, common things include chest pain, sometimes feeling lightheaded or even fainting, palpitations.
Palpitations, like feeling your heart racing or pounding?
Exactly that sensation. Also, shortness of breath, especially with activity, feeling unusually tired, fatigue, and sometimes swelling, particularly in the legs, ankles, feet, or even the abdomen. It's also worth noting that symptoms can sometimes get worse later in life. As the heart muscle potentially gets stiffer over time, pumping becomes even harder work. Again, the specific symptoms really depend on which part of the heart is thickest and how stiff it's become.
Okay, so a range of possibilities, and not everyone experiences them. But let's dig a bit deeper now. Beyond those common symptoms, what are the more serious things that HCM can potentially lead to? This is where it gets, well, quite critical, right?
It is. While many people manage HCM well, there are definitely potential complications we need to be aware of. One major area is abnormal heart rhythms, arrhythmias. Things like atrial fibrillation, that's where the top chambers of the heart beat irregularly, or heart block, which messes with the heart's electrical signals. And crucially, though it's rare, HCM does carry a risk of developing very dangerous fast heart rhythms that can cause the heart to stop suddenly cardiac arrest.
Sudden cardiac arrest? That's obviously incredibly serious.
It is. And that's a huge reason why getting diagnosed is so vital. Because if you know the risk is there, steps can often be taken to prevent it. Other potential issues include endocarditis, that's an infection of the heart lining, and sometimes problems with heart valves, like the mitral valve leaking blood backward instead of forward, mitral regurgitation.
It really drives home the importance of catching it early. So with all that in mind, how do doctors actually figure out if someone has HCM? What's the diagnostic process look like?
Well, it usually kicks off with the basics. A doctor will talk to you, ask about your symptoms, your medical history, and very importantly, your family's medical history. They'll do a physical exam, listen to your heart and lungs, check your pulse, blood pressure. Then come the specific tests. An ECG, electrocardiogram, is standard. It's quick, painless, records the heart's electrical activity, rate, and rhythm.
Okay.
An echocardiogram is key too. That's an ultrasound scan of the heart. It gives moving pictures showing the structure, the muscle thickness, how well it's pumping, how the valves are working.
So you can actually see the thickening.
Yes, precisely. And then there's Holter monitoring.
That's where you wear a device for a while.
Exactly. You wear a portable ECG monitor, usually for 24 to 48 hours initially while you go about your normal day. It's looking for any arrhythmias that might not show up on a short in-clinic ECG. You usually keep a diary of your activities and symptoms too. But here's a key point for HCM. Sometimes those significant arrhythmias don't happen very often. So that standard 24 or 48 hours might not be long enough to catch them.
Right, you could miss it.
You could. So patients might need what we call extended monitoring, using perhaps more advanced wearable monitors for, say, 14 days, sometimes even longer. This longer look is really important for detecting those infrequent but potentially serious rhythm problems, and it helps doctors assess the risk of sudden cardiac death and decide on the best treatment.
Makes sense. Get a longer window to see what's really going on. Are there other tests involved?
Yes, sometimes an exercise test is done. That's where you have an ECG while you walk on a treadmill or cycle on a stationary bike. It shows how your heart responds to physical stress. And an MRI scan, a cardiac MRI, can also be really useful. It gives very detailed pictures of the heart muscle and structure.
Okay, quite a thorough workup. Now, I remember seeing in our sources a distinction between obstructive and non-obstructive HCM. Could you break that down for us? What's the difference?
Sure. It's an important difference, mainly related to blood flow. In obstructive HCM, the thickened muscle, often the septum, actually bulges into the path where blood flows out of the left ventricle. It physically blocks or obstructs the blood flow leaving the heart.
Okay. Like a bottleneck.
Pretty much.
Yeah.
And this obstruction can lead to more noticeable symptoms and potentially more issues like those arrhythmias or valve problems we talked about. In non-obstructive HCM, the muscle is still thickened, but it doesn't significantly block the path of blood flowing out of the heart. The flow isn't reduced in the same way.
Got it. So, same underlying muscle thickening, but different impact on blood getting out.
Exactly. The functional impact is the key difference.
Right. Now, let's circle back to the genetics for a moment. We established it's mostly inherited. So what about genetic testing itself? How does that fit into the picture?
Genetic testing has become a really valuable tool. If a doctor suspects HEM based on the other tests, they might offer a genetic test, usually a blood test, to look for one of the known gene mutations that cause it.
And if they find one?
Well, finding a specific faulty gene confirms the diagnosis, first of all, but maybe even more importantly, it has implications for the family. If a mutation is identified in you, then your close blood relatives, parents, siblings, children, should definitely be informed. The recommendation then is for them to be assessed, ideally at a specialist clinic that deals with inherited heart conditions. They can discuss their own risk, the option of genetic testing for themselves, and get screened for HCM with things like ECGs and echoes.
So it becomes a family affair in terms of awareness and screening.
Absolutely. It's about being proactive and trying to catch it early in other family members who might have inherited the same gene. It's a key part of managing HCM across generations.
That really underscores the power of knowing your family history. Okay, so let's move to the final piece, treatment. Our sources were clear, there's no cure right now, but what can be done to manage HCM?
You're right, no cure yet, but there's actually a lot that can be done to manage symptoms and, crucially, to prevent those serious complications. The approach is very much tailored to the individual.
What does that usually involve? Medicines?
Medicines are often the first line. Things like diuretics might be used to help manage fluid buildup if there's shortness of breath or swelling. Beta blockers are common. They slow the heart rate and reduce how hard the heart has to work. There are also calcium channel blockers sometimes, and newer drugs called cardiac myosin inhibitors, which directly target the underlying muscle problem in HCM, helping the muscle relax better. The goal with meds is usually to control blood pressure, keep the heart rhythm stable, and just generally ease symptoms like chest pain or breathlessness.
Okay, so medications play a big role. What about other approaches, more interventional things?
Yes, for some people, more is needed. If someone is found to be at high risk of those life-threatening fast heart rhythms, they might need an ICD, an implantable cardioverter defibrillator.
That's a device that can shock the heart back to normal rhythm.
Exactly. It monitors the heart rhythm constantly and delivers a shock if a dangerous rhythm starts. Sometimes a related device called CRT, cardiac resynchronization therapy, is used too, which is a more sophisticated type of pacemaker. In very severe cases where the heart is really struggling to pump blood despite other treatments, sometimes an LVAD, a left ventricular assist device, basically a mechanical heart pump might be considered, but that's less common for HCM specifically. And standard pacemakers might also be used just to regulate a slow heart rate, if that's an issue like with heart block.
So quite a range of options depending on the specific problems and risks.
Definitely. From managing daily symptoms with medication to sophisticated devices for preventing the most severe outcomes, it's about finding the right strategy for each person.
It really paints a picture of a condition that requires careful, personalized management, drawing on a lot of different tools. We've covered a lot of ground here, from understanding the thick, stiff heart muscle to its genetic roots, how it's diagnosed with various tests like extended monitoring, and the different ways it can be treated. It really shows how valuable it is to understand these complex conditions.
Absolutely. And I think this dive into HCM, it really highlights not just the heart's complexities, but also how powerful genetic knowledge can be, and the importance of thinking about health not just individually, but within our families. Kind of leaves you with a thought, doesn't it?
Yeah.
Knowing about conditions like HCM, especially that inherited part. What does that mean for how we should approach our own health conversations and the ones we have with the people closest to us?
That's a powerful question to reflect on. A big thank you for joining us on the deep dive today. We hope this journey through HCM has been enlightening. Keep asking questions, keep exploring, and we'll catch you on the next deep dive.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.